Well, I think it's 10:04. I think we can get started. I see people keep joining, so that's good. There's quite a few who listening through audio only, so that's good. We've received a lot of questions from the people who were registering. Unfortunately, I haven't been able to accommodate all of the questions with some of the questions that I shared with you guys in advance, but we'll try to get to all of them through this webinar, and then we'll reserve the time towards the end for any of the Q&A and any questions that come out throughout this conversation. I'm personally very excited about this webinar because it's been in the making, in the planning for quite some time, and we have a great panel for you guys this morning with two very highly accomplished healthcare executives. So let me just do a quick introductions, and then I'll let you guys take it from there in terms of giving a little bit of a background on who you are and what you guys represent. Elodie Dorso, she's the Chief Executive Officer of Community Health Center of Pinellas. And Joey Resnick, he's the CEO of Premier Community Healthcare Group. So Elodie, let me start with you. If you don't mind, can you share with us a little bit background on your organization, what falls under your purview, and any of the latest kind of adjustments that you guys had to make as part of the recent times?
Sure, absolutely. So Community Health Centers of Pinellas is located in Pinellas County, which is on the Gulf Coast of Florida. We are the second smallest county in the state, but the most densely populated county in the state, with more than 3,500 residents per square mile. Community Health Centers of Pinellas has 12 standalone facilities and 1 mobile health center. And we see about 60,000 patients a year for about 200,000 visits. And we run the gamut for primary care. So family and internal medicine, pediatrics, OBGYN, dental, chiropractic services, podiatry, behavioral health, clinical pharmacy, on-site pharmacy, case management, nutrition services, the whole gamut of primary care. But really, since COVID, we've seen a significant decline in our in-office patient visits, as everybody in the industry has. And we've had the opportunity to really transform almost 60% of our visits over to virtual or telehealth in order to meet our patients' needs. All of our clinical services, including dental, rapidly implemented telehealth using varying modalities, including audio and visual through Zoom, FaceTime, and DoxyMe. We started out with Zoom and FaceTime, but are strictly using DoxyMe right now, as it's an easier way for our providers to send a link to our patients. In addition, we transformed a couple of our centers into well centers only, where we only see non-sick pediatric patients for well child checks, immunizations, and also newborn visits. Of course, like many other community health centers, we opened up drive-through sites to test for COVID-19, both symptomatic and asymptomatic in the community. And we are the major player in the community testing for this. About 300 patients a day we're testing through our drive-through sites. And now we're actually going out to community members to test with rapid tests, such as the St. Petersburg Police Department. And we plan to do some long-term care facilities as well. We also allowed staff to work remotely, whose duties allow them to. And so that's been a real satisfier for them. And then we've implemented a software system that allows our patients to wait in their car, and we can text them, much like a restaurant waiting list, so that we can manage the flow of our patients and really make sure that we don't have too many people in our centers to ensure the safety of employees and patients.
Very interesting. Thank you for sharing that, Elodie. Joey, what about you? If you don't mind, just a few words about your background and kind of your operations.
Sure, don't mind at all. Again, Joey Resnick with Premier Community Healthcare. Brotherhood, sisterhood is that, we all have the same mission and serving the same patient population and the same goals at the end of the day. And it's amazing. And I say this so Elodie and I can pick up the phone and say, Elodie, have you done this? And she's like, yeah, we did it this way. Or she'll pick up the phone, and ask the same sort of question. So it's really, the FQHC world is truly about that patient care. And it's just been, again, it's been life-changing for me. I was talking to one of my care team members yesterday, and she's like, I just want to tell you how much I like working here. And I said, I don't even look at it like it's a job. Like, you know, it really is fun to come to work and make the impact that we have really on the community, our patients, and our employees. So from Premier's perspective, we formed in 1979. We started in Dade City at a Jackson Memorial Hospital. And now we've grown since then, and we have 10 clinical sites, 1 mobile unit, and we are in 2 counties, so Pasco and Hernando County. A little smaller than Elodie from a patient visit perspective, and then we saw a little over 37,000 patients. We will, same gamut of services, not as in depth. We are looking at adding chiropractic, but we have adult pediatrics, women's behavior, dental. We have care coordination and referral specialists as well. In addition to that, I think what makes, again, the community health centers is that, you know, we have community staff that actually then they go out to the community to help provide access to the patients that can't come to us. From a planning perspective, we are going to add 2 dental sites and another mobile unit in Pasco County, and should be around September. And then we're also going to do some dental and medical integration. We are going to renovate a site that will connect our family and pediatric, one of those sites, to a dental, and to be able to provide hygiene. You know, from a COVID-19 perspective, is that it was very, very quick on reaction. You know, we did the same thing, is that we went into doxy.me. We implemented that in 2 weeks. And so we've had some of our providers that are doing that. So we have all service lines that are available for telehealth through doxy.me, except for dental. We did not go that route. Dental is starting to open back up. You know, and in Florida here, the governor signed, you know, the executive order that we could only do emergency procedures, and volume dropped by 80%. Overall, from a Premier perspective, we're down about 30% across the board. We went to, in our sites, we went to well in the morning and sick at night. We didn't do what Ellie did and take a site and make it specific for well patients. But we did do that. We had implemented outside screening, but we just stopped doing that this week, and we are going to the same sort of system as that. You know, all of our staff are required to wear masks when on our clinical sites, and so the patients, and we're limiting the number of patients that are in the waiting rooms, and they go to their cars as well. So from an administrative perspective, we moved our call center. Some of our staff in our call center went to their houses. In addition to that, we moved them into our sites if we had an empty office, just to get that social distancing in our call center. We moved them. They're actually going to come back as well. We're starting that this week. And then an administrative staff who could work remote and come into the offices, some days in the offices and some days remote. So that's a little bit about us and myself.
Great. Thank you so much, Joey. Appreciate it. Elodie, you've touched a little bit on telemedicine, telehealth, some of the technologies you guys started adopting a little bit more aggressively, I guess, this year. Can you tell us a little bit more about, you know, the telemedicine as part of your healthcare delivery strategy? Just some practical, you know, recommendations. How does it work in general? Any specific technology that you guys had to implement? Just curious to hear any case studies that have worked well for you through this period, or any lessons learned. Would be curious to get your opinion on that.
Absolutely. And so prior to COVID, we were only using telehealth primarily with our behavioral health specialists on a limited basis, and also with our clinical pharmacists. So really, the pandemic, we took it as an opportunity, right? As an opportunity to implement this solution, which we had been talking about for many, many years, but for reimbursement purposes, weren't able to provide to our patients. Thankfully, through this pandemic, the regulations changed, and we were able to provide, continuing to provide services through telehealth. You know, as I said, we started out very quickly in the first week with audio only, so telephonic visits, and we knew that that was not meeting the needs of our patients. And so we switched over to FaceTime and Zoom. It seemed to be a little bit challenging for some of our providers. They weren't able to get the links to the patients the appropriate way. And so quickly we switched over to doxy.me. Now, Doxy.me has been an easier solution for our providers, and it's been easy for our patients to get on. However, I will say it's not our solution long-term. What we've found is that none of the modalities that we're currently using allow us the flexibility or the functionalities that we want to begin to continue to provide care. So, we want to be able to have more than one person in the session. So a medical assistant and a provider and a behavioral health specialist or a case manager or a translator or a support caregiver that may not be where the patient is at physically when they're doing their telehealth session. So these are all of the things that we're looking to do in the future, and we're actually beginning to move forward in implementation of a new software system called InTouch. We're going to be starting that in the next 2 weeks. That allows us to customize the way we want to see our patients. We can kind of structure the visit much more like an office visit, where the MA kind of checks the patient in, takes the health history, the provider comes in, maybe a warm handoff to a behavioral health specialist, and then the case manager wraps up the visits to make sure that they understand what referrals and if they need any help. And so that's really where we're moving, and we're investing in this because we know that telehealth is here to stay, and it's part of our long-term strategy.
Great. Thank you for sharing those examples. Joey, from your perspective, what trends are you already seeing as being developed that will shape our healthcare system in general post-COVID?
Well, it's that the biggest trend is that, to get people to come to the offices and come in site. So, I mean, and those that want to be on site, is that how do we provide that safe environment when they walk in our door, that they feel safe, and, they also have the ability to, they want access in that regard. So, we are, same thing with regards to a lot of it going to, and I talked about Doxy.me, we're going to go, it's telemedicine. Again, we're trying to implement the next couple months as well, Frasia. So we're going to do that implementation. I think trends on the communication is that, it used to be, I think we were communicating with our patients that these are the services that we offer. And now that communication is, come see us because we provide that safe environment. And this is how we're doing that. We've gone to implementing as well as communicating with our patients via text to say that we are open. We send postcards. So it's really that, what's that new norm look like? And it's different for dental. I mean, dental obvious is a very, very high risk, from an exposure standpoint. So we are moving slowly to open that back up 100%. And unfortunately, we had to furlough our dental staff. So we furloughed 25 people for 4 weeks. Now they're back. So everybody's back. We were fortunate enough to get paycheck protection, so we were able to bring that staff back. So I think it's, when you talk about trends of healthcare, as I always apply it to myself, is that if I'm the patient, what do I want it to be? I want to walk in, I want to feel safe, and it's going to force, I think, a lot on the demand on the telemedicine, because at the end of the day, we still got to get people to come in, because you still got to give your vaccines to your kids. And is that, how do you get the parents that are comfortable? You're going to split waiting rooms. So we're actually looking at all of our locations from a physical standpoint to say, how can we create those barriers to create that safe environment?
Great examples, Joey. Thank you for that. Elodie, Joey briefly touched upon patient safety in his response. From your standpoint, how has the use of telemedicine impacted your patient experience, if at all? Why do you think other healthcare providers should leverage telehealth for their operations?
Yeah, I think that the use of telemedicine has been really impacted both patient and employee safety, right? Making sure that those patients who may not need a physical exam are not coming into our centers and potentially being exposed to infected patients, and also the same for our employees. I mean, telehealth has had a great impact on provider satisfaction and patient satisfaction, really providing an outlet and variation for the scheduling of the visits and the ability for our patients to get seen at home and our providers to work at home. And so, obviously patients can more easily fit these telehealth visits into their schedule. The lifestyles of many of our patients and make it very challenging for them to come in. For example, a chronic disease patient who has, a very demanding job or can't take off, and a family life that is demanding. We often see a lot of frequent cancellations with them, right? Now we can meet them where they're at, whether it's at home, at office, or at another location, and they can make becoming healthy or getting well part of their lifestyle, right? It's not a nuance. It's not one more thing that they need to add to their schedule. It's really, 15 or 20 minutes where they're at, rather than an hour or an hour and a half coming in. And like Joey said, there are still many of patients who need to physically come in, but sometimes follow-up appointments don't require an actual physical assessment. And so that's really what we see with this telehealth is decreasing the burden on our patients to allow them to promote significant changes for healthier lifestyles for themselves in the future.
And Elodie, on top of that, how do you guys raise awareness about the availability of such services, telemedicine, telehealth? Because I would imagine there's a good population that's not fully aware of those, opportunities or capabilities that you guys provide.
Yeah, absolutely. That's a great question. We actually trained all of our call center staff and all of our front office staff as well. And so when patients are coming in for specific reasons, we offer them the telehealth option. And so we begin to make sure that we're routing visits in an appropriate manner to ensure, again, safety of our patients and our employees who are coming into our facilities. It took a little while first, right? We have to do still a lot of vetting of those schedules. And sometimes patients come in for a physical assessment and we route them to a telehealth assessment because we're not sure of their confirmed or non-confirmed status of COVID-19. So we want to make sure that we see patients in whichever way is safest for them and for our employees.
Great. Joey, when it comes to physician or staff safety during pandemics such as COVID-19, what strategies have you deployed that ensured proper safety measures are in place within your operations? What did you learn from this period so far?
Learned a lot, I would say that. I mean, from the perspective is that, we needed our care team members to know that safety is priority one. So as soon as it happened, we had a full staff call in and say, this is our strategy with regards to safety. So we do our PPE and we were doing our inventory on a weekly basis. We were communicating, with our care team members of this is the amount of PPE that we have. And these are our strategies. So when we had full PPE, it was, you could use the mask at will. When we started to get low, we would communicate that and change that and say, okay, now it's one mask per day. And then also we ended up and we did fit testing on the N95s for all our providers to make sure to double check that safety and give them that, yep, these are the masks and we're really, really safe. In addition to that, we have gone into that, again, keeping our waiting rooms that, not having anybody waiting in there. We also made sure from a cleaning perspective, exactly, and re-educated our staff on our cleaning procedures and that after every visit, this is what needs to be done. We already had those in place, but again, we went back to just reinforcing those safety measures. And we have and the other thing that we've done is that anybody can send a question in. So we have a daily call with all of our managers to give them an update as to, here's what happened yesterday, here's what's happening today, and here's what we're planning. So we implemented community-wide testing last week. And so, we told our managers every day and said, okay, in 2 weeks, this is what we're doing. There are no surprises. We were very clear on which PPE we're using. So we weren't sending the message that we're taking PPE from our offices to do the community-wide testing. We worked with a partnership with our Department of Health and our emergency operations to help supplement that. And then we also have every 2 weeks, we continue that full staff call-in. And then that call-in is our executive team. So every call-in, our Chief Medical Officer, Dr. Heron, can answer a question and give directions. So for example, is that we also implemented a policy regarding travel. And then we followed that if you do travel, that you are going to self-quarantine for 14 days. So we really looked and we followed the CDC guidelines to guide us and really implemented those guidelines across all of our sites.
Great. Thank you for sharing that, Joey. Elodie, from your standpoint, I would imagine a lot of similar strategies from the physician and staff safety perspective. Anything you would like to add, what you guys had gone through this period?
I think that from the safety perspective, I think that we've done a lot of what Joey's done and her team has done. One thing that we have is we actually have a full-time staff member working with varying vendors, I guess I would say, to secure PPE. I mean, that has been the biggest challenge. We were fortunate that we actually had a pandemic policy in place and had just gone through pandemic training in January of 2020. I had no idea, but it worked out that way. So we had about a 3-month supply of PPE. We also had what was called P100 respirators, which are better and reusable than the N95. So anytime that one of my providers or employees were potentially exposed to a COVID-19 patient, they would be wearing their P100s. And also my dental team are wearing P100s because obviously it's a higher risk area as well. But lots of communication. I really think that, I think that's what's helped us is being transparent. So.
Great. Thank you for that. And Elodie, just to stay with you on a similar topic, with so many companies going through downsizing, layoffs, and furloughs, and et cetera, with the impact from the pandemic, as an executive, how do you ensure that proper staff motivation and productivity at your company, maintains within the same levels as it was prior to this?
Yeah, that's a good question. I think that now more than ever, it's my job to facilitate the success of my team, right? And it's hard. I mean, I think that people were nervous in the beginning. They kind of got complacent in the middle, and now they're seeing a little bit of a spike. They're nervous again, right? And so really being transparent and open and honest about what the situation is in our organization, where we're at. We too had to furlough employees for about 4 weeks. We brought them back, and at that time, our entire senior leader team also took a payroll deduction to help, solidify and stand with those employees that we had to furlough. In addition, when my furloughed employees came back, we made them whole. We made them whole between what they got with their unemployment and what they would have gotten paid with us. And so, that was really important because we want them to stay with us long term. Really, we've kind of kept the well-being of our employees as our #1 priority. So financially, mentally, physically, and really family stability. Across the nation, schools were closing. And what were employees supposed to do? And I needed to come to work to see my patients, right? And so we worked with local YMCAs and art clubs and found funds to cover the cost of childcare for any employee who didn't have childcare or needed help. And that was a big motivator for our staff and allowed them to come to work. Although we weren't part of the emergency sick paid leave policy the federal government put down, we did create our own paid leave policy for those who could become potentially positive through our work environment. Fortunately, we've not had any positive employees yet, but we've had situations where we've had to remove people and either allow them to telecommute from home or pay them pending their results. And so that's been real good. We've also offered increased confidential counseling for all of our employees. This is a high-level stress time, and we want them to take care of themselves mentally. We've closed down half days and paid people for mental health breaks, and we've brought in lawyers for some kind of civil legal issues to help them with life planning, possible evictions, on top of all the normal motivators, lunch for our staff, small bonuses, Kona ice trucks, things like that, really. And then just making sure that senior leadership is out in the centers, right? I mean, so often they think that leaders don't come out in the centers when the times are hard. And so making sure that our faces are being seen by all of our employees as well.
Great. Thank you for sharing that, Elodie. Joey, from your standpoint, if you don't mind sharing some of the strategies you had to implement when it comes to employee motivation and, performance.
Sure. I think Elodie hit on it as well. One of those is the transparency and the communication. I mean, we wanted our care team members to know, okay, this is where we stand. This is where we look like from a financial standpoint, and here's the impact that it has. So when we had to furlough, we told obviously our dental staff, but we also shared that with our entire staff. We shared the why. This is why. We also shared, if we do get it, we have plans that, if we do get paycheck protection, they'll come back. If we don't, we have these plans. In addition to that, it's really that, and I found that employees, where are they going to get the information from, and who can they go to? So if they had a question, is that, okay, my sister's husband has it, what do I do? And we really opened up Dr. Heron, our chief nursing officer, our chief medical officer, and Dinah Grant, who's our chief nursing officer, our director of nursing, to answer those questions and to have those. And we've communicated those questions to all our staff, because if one person was asking and one care team member, it had to go everybody else. We do have, we have, and again, we really reduced the productivity expectations. Is that, let's be reality. If we went there, we lost 80% in dental. If we're talking about that, we know that our volumes are down by 50%, and we tracked it by specific discipline. We can't expect our care team and our providers to see the same amount. So we took those out and said, okay, we're going to see what we can see and get our volumes. The thing that I found, and I think this is it for everybody, when you get into healthcare, is they want the passion to help. And so it wasn't that, they really want to know, okay, the organization, Premier, we're doing everything we can to keep us stable, to keep jobs. They had friends that were losing jobs. They had friends that were laid off, and they had no idea. And we would ask our care team members, and they would know everything. There is nothing hidden. We share everything. The only thing we don't share is our salaries. Other than that, we can say, for example, and we're committed to applying for every grant that we possibly can to help us. So we applied for Paycheck Protection. We got a couple grants we worked with the county, and the counties are generous enough to help support us and help, what we do and continue our mission. And all that's laid out. So I think for me is that it's providing that security. So if we go to our staff and we're saying, and which we did, our goal is to keep everybody as part of our care team. We don't want to do layoffs. And the furlough was a good example. We could have done layoffs, but we chose to do the furlough. And just like Elodie, during that time, we covered their health insurance for them. We did not want to put our staff out there and say, okay, I lost my job and I have no health insurance. It's just not everything that our care team members do for us. We always want to do it one better and say, how can we get better? And wide open to suggestions. We had employees that would call and say, hey, can we look at this? Can you guys look at this? And some of them we said yes, and some of them we said no. But the biggest thing is to understand why we're making those decisions. And so, for example, we're going to do construction, and we've talked about it and said, yes, we're going to do construction. You're going to see that. We put our merit increases on hold because we want to make sure that financially we're stable, but yet that dollars that we're spending on construction is coming from a grant that's restricted. It can only be used for construction. It can't be used to supplement, salaries and wages.
It makes sense. And what stood out to me is really reducing the expectations for the productivity and performance. I think it's very important, often overlooked, especially during times like this. So thank you for sharing those examples with us. Elodie, there are a lot of topics on leadership through crisis, especially these days, but not too much emphasis on personal productivity strategies as an executive. Curious to hear what has helped you personally to stay productive. Any specific recommendations that you provide to your teammates or your peers in the industry?
Yeah, I think that staying productive and on task has been a challenge for many of us, and I'm not an exclusion of that. I have to tell you that I've learned over the last several months that I have to give myself a little bit more grace than I normally would, right? The natural rhythms of all of our life have been upended. And then, if you're like me, a mother of 3 teenage girls, you're helping them navigate this new normal reality as well. And so what's really kind of helped me is kind of keeping a schedule similar to pre-COVID, right? I get up every morning at the same time. I exercise every morning. I know Joey's shaking his head because he does the same thing. I map out my intentions for the day, right? Allowing me to make a must-do's list for that day and what I'm going to get to for the week. Really kind of marking off those items as to-dos really gives me a sense of accomplishments and keeps me on task, because there are fires coming at you every single moment of the day. But there are still things that have to get done. We're still running a business, right? So I also had to set some ground rules. I too am working part-time in the office and part-time at home, which can be challenging because there can be a lot of distractions, not only from yourself or things that you want to do, but from your family. I'm fortunate enough to have an office. And so when I went into my office at home and closed the door, it was if I wasn't at home. That was for myself and for my family. And we had to sit down and set some ground rules as a family together to do that. But really, I've also taken this time to look at my leadership style, kind of revamp that and see where I can better myself for my employees and the organization, and look at this as a reset, right? We've been able to do incredible things, my team and myself, during this pandemic, as many of my sister FQHCs have. I mean, things that we didn't think that we could do and the time frames that we were able to. I think what it's shown us is that we're capable of much more than we realized, right? We are the backbone of the vulnerable population in this community and providing healthcare to them. And I'm really amazed at how well we've all done with what we've been working with.
That's great. And I really like what you said in terms of that self-reflection exercise. I think as a leader, it's really important to take that step back and really self-evaluate your leadership style, your communication style, and so forth. So that's very exciting to hear. Thank you for sharing those examples, Elodie. Joey, from your standpoint, anything that you would like to share with us when it comes to that self-productivity, self-motivation?
Yeah, I think it's, and Ellie touched on it, it's really trying to maintain that routine. I'm a routine person. That's just my personality. And it's that, how do I make it the same, and what is it? So I do I get up in the morning, I keep my morning routine. When I'm at home, if I'm working at home, it's the same thing that, I get in there and I say, okay, this is what I'm doing and focus. I also think it's the balance. I'm big into obviously the wellness component of, but it's taking that mental break to get away from it. And as we went through this pandemic, you're like, okay, it's 24/7 and it just keeps coming at us and keeps coming at us. So it's important, to take care of yourselves, from a health perspective and a mental perspective. And there's no shame in calling a peer and saying, hey, I'm struggling with this. What are you guys doing? And I go back to, to my first comment when I said that it's a brotherhood, sisterhood. I know that I can pick up the phone and, I can reach out to Elodie, or I could reach out to any other CEO in a community health center, and they're going to take the call or they're going to call me back. Because, and it's admitting, I think the big thing is to admit, I don't have the answers. I don't know the answers. I mean, I can sit there and say, I don't have them all. I don't know them, but it's also, making sure that our team stays together. And, you got to just still got to laugh. You still got to have fun. So when we get into our executive meetings, we start every day on our calls to our managers with a corny joke. Now, this is no joking matter, but it sets the tone. We started our full staff meetings with music. So now I'm getting music requests. And so, it's don't lose sight of it, is that, you still got to be able, to me, it's that smile and the laugh and take care of ourselves. And again, for our care team members, we did same thing, is that mental health, mental health is just as important, and take the time and be with your families and make sure that, again, there is no ask for help. There's nothing wrong. Yes, we're sitting in, we're the leader, but leaders need help too. I don't do it myself. There is no I. And so I'm happy to lean on any of our care team members, from an executive team. We all support each other. And we've had those conversations about, what are you doing? What are you doing? How do you do it? How do you work more efficiently at home? And some do it better. Some are like, I can close the door. I have rules, or I make sure that when I'm at home, make sure you take a break every 2 hours and just get up and stretch. You can't sit at your desk for 8 hours. So, but that's it. That's what I've got on that one.
No, great recommendations, Joey. And what stood out for me is, if I was to summarize it, really taking that humble approach and really admitting if you don't know something or you do need help. I think it's also very important to keep in mind as an executive, as a lot of people are looking up to you. I think that sets the tone, it sets the right example for everybody else. Joey, to stay on with you, I'm curious, how are you preparing your organization for the next period, whatever that is? What strategic initiatives are in place to ensure, continuity and company growth?
We just actually, so I think we went through the months of being really reactive. And so as we were going through the pandemics, like, okay, all we talked about, we put everything aside, and it was COVID-19, 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 for 2-3 months. And we have just started actually to try to get back what I'm calling the new norm and revisit in our strategies and our strategic plan. We're doing a strategic plan reset this month that we will present to at the end of the month to our board. And so, as I talked about, some of those, when we looked at those grant opportunities and those monies, is that we said, okay, what can we do now and use it for COVID, but also how will that help us in the future to provide more access? So for example, we've talked about doing a mobile unit, like a van where we could take and do testing, but then that van could also, serve as, we could go outreach and do dental. So it could be a combination. So we're really getting into those to not lose sight, to get through the reaction, and now getting back into, okay, here's our strategic plan. We had it for this year, obviously is going to be a reset. And how does this reset then go down the next 3 years? It's a hard one. Ellie said it before when we were talking, is that we don't know what's coming in the next month. We don't know if there's a resurge. We don't know what's going to happen, but we are continue looking, how do we increase access to the patients? And again, it's our vulnerable population that we serve.
Right, absolutely. Elodie, to switch topics a little bit, attracting top talent during COVID, what strategies have worked well for you at Community Health Center of Pinellas in terms of attracting, continuing the top talent to your organization?
That's a great question. We actually put our hiring on hold for almost 60 days during this. I mean, we just didn't know where we were going to go. I couldn't fathom bringing in new people when I had furloughed some of my dental employees. But as we began to open back up and bring dental employees back and really look at where we were going in the future, we clearly had some holes that we needed to. And my HR team has really done a good job of really digitizing everything, right? From recruitment to the application process, to the interview process, to the employee paperwork, and even orientation we're doing online now as well. And so that piece of it, but really, our biggest asset is our story about what we do to serve our patients in the community, our story about how happy our employees are, the data of where our quality measures are. I mean, we are nationally known for quality of care and cost efficiency. And for us, recruitment has not been an issue because of that. I mean, our story is what makes us whole and who we are, and our team is really all a part of it. And so we've actually recruited 3 new physicians and an APRN just in the last 2 weeks. So they're going to be starting with me in the next 60 days. And so recruitment has not been an issue. And I would assume that for many community health centers, it won't be either, because their story is something to tell. I mean, all of my sisters and brothers in this have quality measures. I think that that's what makes us different from a private physician, right? Our mission, our vision, our data that we can back up our story with, and the fact that we're always here for the community. And so we have not had any trouble with recruitment yet.
Joey, anything from your standpoint when it comes to recruitment and attracting top talent?
Same story here. We put positions on hold, for the time being. And then it was actually interesting. We had a couple dental staff, and we said, they were going to come on board, and we called them. We said, this is where we sit today. And because I don't want you to make a decision that all of a sudden you're going to come start working for us and you don't know that there's a potential to be furloughed. So again, it goes back to transparency of, and they made the decision, and couple of them stayed, a couple of them said, you know what, we want to join this team. I think that, when you talk about providers, it goes to where can I have the biggest impact? And that's at a community health center. I mean, as my dad's coming at the end of the month, and he's like, I can't wait to see your sites. And I keep trying to recruit him to come because, you just can. And I think, again, it goes back to that passion. If you want to be in a position that serves our community, that's what we do. And you're going to make a difference from a healthcare perspective. Now, I will say, I think that it'll be interesting for us because we are starting to see from a medical assistant for that pool to dwindle, because we've reached out to the schools, and they've seen their enrollment go down. And so it'll be interesting for us from a recruiting standpoint when we go to the medical assistants to see what happens. I do think that we have seen some nursing care team that have left the hospital setting and are now interested in going to a clinic. So the whole market's going to shift. And I think the people and that make the choice to come into healthcare know what you're getting into, because I mean, nobody could have predicted a pandemic. And so I don't know how many people signed up for it to, when you walk in, but now you know that. So I think if you're making a choice to be in healthcare, that's a potential that could happen. So, right. But again, it's our story. Sorry. I mean, it's our story. It's what we do. I mean, I could talk about it for 3 hours. I really could. I mean, it's just exciting. It is. I mean, it is. And it's not just, and then when I say our story, it's not Premier's story. It's the 1,400 community health centers across the country's story. Right. Is that, you could call any of them up and they can tell you story after story that if they didn't exist, somebody wouldn't have access to healthcare.
Mm-hmm. Absolutely. Couldn't agree more with you. And Joey, from your standpoint, to take that question a little bit further, curious, what are the most in-demand skill set that you currently may be looking for at Premier Community Healthcare Group? And which ones are hardest to find, especially these days?
We've had the hardest struggle with nursing. We really have, from a nursing perspective. Even before the pandemic, we struggled a little bit on the nursing side. We didn't struggle on the provider side so much because, again, at the end of the day, that provider is leading that care team and wants to make that decision to join a community health center. So we struggled, again, with the clinical side, the nursing side. Other than that, we've been pretty steady. The other one that we've also again is on the behavioral health side, mental health side, to provide a licensed clinical social worker are extremely hard to find. Now we've actually had success, and we've added 2.5 LCSWs during the pandemic, so which was a surprise to me. I mean, but again, it goes back to is they seeked out to where can I make a difference. Mm-hmm. So that's where we struggled. Again, if anybody has any ideas on how to make us better, I'm open book. Send them.
Sure will. Elodie, from the overall healthcare trends, what are you currently researching that you would like to see implemented at your organization through the next period?
Sure. So specialty care is really hard for our patients to get. And so as we're looking to move forward and make telehealth a mainstay with our organization, where we're really looking at more remote and asynchronous possibilities with our specialty care, right? It allows our patients to access that care through us, right? Reducing the wait times that they would have, that they often get for seeing specialists. And also it allows our physicians to still coordinate that care and get answers from the specialist that they may not be able to if we send the patients out. So that's one of the areas. The other area is remote patient monitoring. Really being able to get real-time data on our patients, whether it's weight, whether it's A1Cs, whether it's blood pressure, any of that, when they're at home, so that we can really see them and coordinate their care more often. Patients with chronic disease needs to be seen more than once every 3 months. I mean, and it's a struggle for them, as we talked about, to come in. And so really having that remote patient monitoring paired with a telehealth visit, I think is going to take us to the next level and getting our communities healthy.
And it sounds like technology is at the core of a lot
Absolutely.
of the trends, a lot of the, the next things that, a lot of the health centers, a lot of the hospitals could definitely benefit from. Joey, from your standpoint, anything that you'd like to add from the healthcare trends that you're researching?
No, I think you really hit on it. It's really the technology. And so how do we have, create that bandwidth that even as we have this, we're having the Zoom right now, it's that, okay, is it going to work? So I think it's that demand of how is technology going to keep up with the innovation? Because I think the innovation is there. I mean, if you'd have gone back and said, okay, somebody's going to do teledentistry, like, how can you do teledentistry? But now it's obviously happening. And so I think you're going to see those continuation of how to make it easier for all patients to access any type of care. And so if they can come to a patient-centered medical home like we are, then you say, okay, you come to us, you can go to podiatry, you can go to chiropractor, you can go here, but this is your central hub. So how does that hub communicate out to those spokes?
And let me just jump in there. I think that, this pandemic has really taken us all out of our comfort zone, right? And so many of us have not had telehealth visits and before, we've not done them. Right. My patients were nervous. My providers were nervous. My director of dental was like, how am I going to do remote dental through telehealth, right? I mean, but we did it, and the results are incredible. And so I think that, we grow most when we're uncomfortable. I tell my team that all the time, and this has allowed us to do that, both from the patient perspective and from the provider perspective. And so it's really been a good thing.
Right, absolutely. I love what you said in terms of being uncomfortable is an indicator of growth, and couldn't agree more with you on that. So thank you for sharing that. Joey, you touched a little bit on innovation. When it comes to innovation, especially during these times, what strategies or methodologies do you deploy that consistently help you come up with innovative ways to solve particular problems at your organization?
Team. I think, we open it up and say, okay, what ideas do we have, if we're working, for example, any issue that's out there, or any innovation. And so if we talk about, we're going to have a team group session, we're going to do research to say, okay, who else is doing this and how does that fit into our organization? And it's really being dependent upon and great teams. I mean, I have a great set teams that will go out and say, not only this is what I found, but also having and leaning on their years of experience. So when you have a very, very experienced executive team, we have somebody that was with the Y for 15 years. How does that come into play? We've had another one of our team members that was at another FQHC that served their main mission was the homeless. So she brings a whole nother set of views. It's really opening up to brainstorming and open to new ideas, and not saying that, oh, we can't do that. It's really asking, how do we do this? And then it's also, it's also saying we're going to try it and we're going to track it. And if it's not working, admit we weren't right and make a change. And that's okay. Because again, I go, we try to crawl and then we're going to walk and then we're going to run. And I never want to get to that sprint because it's a marathon. And so sometimes it takes us a little bit longer to get things moving, but I want to make sure that we go through, we talk about what are the pros and the cons, what's going to make this work, and what assumptions did we make, and then debrief about it. Take a look back at it and say, okay, this was correct, this worked. And again, I'll make a decision, we'll make decisions, and I'll make them all day, but I also will know to go back and look at it to say, was that the right decision? And if it wasn't, how do we get back to on track, and what's a better decision point?
Those are great strategies. Thank you for those examples. Elodie, from your standpoint, it seems, innovation is at the core of what you guys do, especially with the latest trends, the latest technologies you guys are implementing throughout your operations. Curious to get your take on the overall innovation at, your organization, and how do you leverage any specific strategies to promote that? Continue.
Sure. Yeah, so I have a motto, it's called fail faster, right? So we'll trial anything for 30 days, right? Anybody, bring me an idea, but you have to be accountable and responsible for it. So I've had medical assistants who wanted to implement things. I've had physicians, and it teaches them that maybe there's other pieces from their perspective, right? I mean, they're not in their own blinders here, but it also allows us as executives to see, okay, the people who are doing it on a day-to-day basis, who are out there on the floor, they know what they're talking about, right? And maybe the idea that they bring to us doesn't work exactly in that manner, but we can take pieces of it, right? And so we've really gotten innovative ways. We've changed our scheduling system through a staff recommendations and really a staff leader. And we've changed the way that we deal with our diabetic patients through a staff recommendation. So we are not afraid to do anything, but I'm not going to keep it going, right? If we're going to do it, let's look at it after 30 days, look at the data. Is it working? Great. What can we capitalize on it? If it's not working, tweak it and try it again, right? I'm not saying that we're not going to do it, but everybody has a stake in this, and everybody, if they have a piece of it and are accountable for a portion of the care that we're giving, they're more likely to be responsible and make sure that we're successful.
Right, absolutely. Thank you for that. And Elodie, there were quite a few questions that came in to us prior to this webinar that had to do with, female leadership or executive leadership amongst, females. And we summarize that question in terms of what recommendations do you have for the aspiring female leaders in healthcare field that are striving to become that next executive? What challenges should they prepare for, and any recommendations to overcome such barriers?
Yeah. I think that's a good question, right? I mean, we are our own worst enemies, I think, sometimes as females. And so I would say, dare to be bold and be different, right? Don't let your own self-doubts get in your way. Sometimes as females, we tend to want to make everything perfect before we move forward, right? A lot of men don't do that. A lot of men take risks and say, let's go. I mean, we feel like we have to have all the pieces in place, right? It places unrealistic expectations and excess pressure on ourselves. It really does. And then we're stuck in one place, right? And so don't do that to yourself. Don't let your own fear cause you to fail. And I have 3 young teenage girls, and I tell them that all the time. And I too have to remind myself of that, right? Because you get in your own head. I also think it's important to have a mentor, right? And where you start in your career, you might have one mentor, and as your career progresses or your priorities change, you might switch mentors. And then I think it's incumbent on us as female executives to be a mentor, right? I mean, it's on us. Diversity is on us. Diversity and race and gender and sexual orientation, that's on us as executives, not just as female executives, but it's on us, and right? And so taking the next hand of the up and coming leaders and saying, let me show you the way, let me help you out. Where do you want to go? Let me give you some tidbits. And so really, I think look to those who've been down the road, learn from some of the mistakes. I think you still have to realize that you're going to make mistakes, and failure is not the enemy, right? We learn when we fail a lot of times, and to realize that taking the next step doesn't have to be perfect, right? You don't have to have the perfect plan, because sometimes that perfect plan isn't always the right plan. So.
Right. Wow. Very inspiring. Thank you for sharing that. There's a question, Joey, I'll let you take that, regarding the second wave of COVID. I'll paraphrase it, but it basically, the gist of that is there a second wave? How do we prepare for that? What is your take on that?
Well, I think we listened to the national experts, and the prediction of the second wave. And I think what it tells us is that, we document what we're doing now and lessons learned. And so I give kudos to Elodie's group for having a pandemic plan, and they went through it in January. So I think we have that now. And so it really would be, revisiting that and knowing that our plans, knowing that we needed to, where are we with our PPE, knowing that we're tracking our PPE burn rate, knowing that, from a perspective of how can we get access to tests, to do that prior. Everything those barriers that we had, that we've taken steps to break those barriers down, is okay, now get them ready and get them fully implemented, and we push the button. Just had the conversation today with the staff member, our care team member at, drive through, and she's like, this is great, because guess what? When it comes back in the fall, we're just going to pull this right back and out, and we're ready to go. So I think it's lessons learned and maintaining those and preparing. Are people going to start stockpiling on PPE so they have it? Of course. I mean, that's what you're going to do. I mean, that's what, we used to say order, we order as you need. Now we're ordering as we can get, to make sure that we're prepared.
Right. Absolutely. Elodie, anything you'd like to add from that standpoint? It seems, you guys were a little bit more proactive, planning at least a little bit to a certain degree for a pandemic. So curious to get your opinion on that, on anything that comes next.
Sure. So I think that we might have been more prepared, but we still felt the strain of the PPE, right? And so now we're stockpiling a 6-month supply on hand. But it's not only PPE; it's what else, right? It's the needles, it's the alcohol swabs. I mean, things that as vaccines become available are going to be scarce. God forbid Florida gets hit by a hurricane this year. I mean, Joey and I are both in Florida. I mean, you won't be able to get supply trucks down here, right? And so we have to make sure that we have the essentials of the toilet paper, of the cleaning supplies online, that if we can't get supplies down here for a month or something, that we can still see those patients who need to be seen. And then really kind of communication with employees, right? I mean, making sure that they're prepared, there may be a next wave, right? You don't want them to get complaints that as this goes along, People don't want to wear their mask all day in the centers, right? I mean, you know, we here in Pinellas County, as many of the other counties, as we've begun to open in Florida, are seeing increased numbers. We're keeping an eye on that. I mean, I have not brought back all of my telecommuting employees because why? Why do I need to do that if they're being productive at home now when I'm increasing my in-office visits with my patients? I don't need excess employees in here right now until I know what's happening out there. And so really just looking at the data, not panicking, and being prepared. I think Joey said it perfectly.
Right, right, absolutely. Thank you for sharing that insight. We almost out of time, and there's a lot of comments that are coming in thanking you guys for, you know, not only this great information. I personally learned a lot. I really appreciate it, but for everything that you guys do, for everything that you guys do in your organizations. Thank you so much for everything. I also would like to thank, you know, Priscilla Torres and the Health Choice Network for helping coordinate this. It was a great webinar, very insightful, a lot of valuable information. Thank you guys so much. Really appreciate it.
Thank you.
Thank you.
Take care, guys.
Be safe.